We are ready to talk with the doc on our 8:30 High Beam. This morning's talk with Dr. Tim McKnight is being brought to you by Mako's Pharmacy at 240 East 3rd Street in downtown New Yorksville. Mako's Pharmacy is your local pharmacy with a caring and knowledgeable staff, which is focused on your health and wellness. So good morning, Dr. McKnight. Everything seems to be well, I hope?
Yeah, doing great. How are you?
Good. I haven't had any problems whatsoever that we want to discuss on the air.
Good thing I left my black bag in the car then, huh?
Well, it's that close. But one thing that you will hear off and on, whether it's serious or non-serious, I think the old timers say, "Well, I had a dizzy spell."
Yes.
And some dizziness seems to be prevalent now and then, and it can be caused by a lot of different things. Is that it?
Yeah, that's a tough one because often dizziness is a term that to me means one thing and to a patient it means something else. So when they say dizzy, I say, do you mean like when you stand up too fast and you get lightheaded? Is that what you're talking about? Or are you talking about a feeling like everything's spinning? And that's a little different. We call that vertigo. And that can be due to a number of conditions. Most of them are harmless, but one in particular can be very dangerous. So we have to kind of ferret through those.
Now, I did tease about BPPV, which is shortened for a fairly long medical term.
Yes, we shorten it because nobody remembers what it stands for. It stands for benign paroxysmal, meaning intermittent, positional vertigo. That means you get dizzy when you move your head a certain way. And the screening question I ask is, does this happen when you're in bed? Does it happen when you roll over? When you're driving and you turn your head to look in your in your blind spot, do you get really dizzy all of a sudden? So those are positional changes of the head that make you very dizzy. That's a really common problem, probably the most common form of dizziness in the office. When people come in the office with complaints, though, of dizziness or a spinning sensation, we're trained to think of the most common condition, the most easy to treat condition, and the most dangerous condition, the one you don't want to miss. Mm-hmm. So we always start out with the most dangerous. Try not to tell the patient that to make them worry, but our initial questions have to do with, could this be a stroke-like condition? This is called vertebral basilar insufficiency, when the blood flow to the base of the brain is impaired, and it can make you feel dizzy. It can make you, you can have some numbness around your mouth. It can cause you to feel nauseous. It can make you drop things. These are usually pretty acute onset. And it's basically a stroke-like symptom, mm-hmm. and those require some kind of imaging of the brain to see if there's an impairment in blood flow. And those have to be treated because otherwise they can be dangerous. They can extend, and then you can't reverse this.
But that blockage could be anywhere in the neck area, or
yes,
it's somewhere between the brain and the heart.
Yeah, it's the arteries that go up the side of the vertebral column, the spinal column that feed the base of the brain. Those are the ones where we worry about those. I don't see that very often. And again, that's usually I'm feeling fine all of a sudden. I've got a bunch of symptoms that are new, and I've already been told I'm at risk for a stroke, or I've had a stroke of some kind. Those are the ones where we have to act on in the emergency room, get them help right away. The most easy to treat cause of dizziness is earwax, and sometimes the earwax will build up to the point where you can't hear very well. It'll make you dizzy, cause ear pain, and it's amazing when we can irrigate this free in most primary care offices. We use a little warm water and hydrogen peroxide. Irrigate it, rinse it a couple times, and it'll pop out, and you can immediately hear. But what's really interesting to me is the dizziness goes away right away. I mean, it's just gone. So that's a real easy to treat condition. We can take care of that in the office. But benign positional paroxysmal vertigo is a really common issue that is easy to diagnose in the office, but most of the time it requires either an ear, nose, and throat doctor or a physical therapist to reposition the head to make the vertiginous or the spinning symptoms stop.
So this is some sort of a muscular retraining that's needed to...
Well, actually, yeah, it's really cool when you look at the inner ear. So inside the eardrum, you have the bones that allow you to hear, because the eardrum kind of vibrates and it rattles these bones that then send a nervous system to your brain that you're picking up sound waves, which we interpret as a voice, and we can understand what that means.
Thank you for the analog lesson.
There you go. But the other part of the inner ear are the semicircular canals. There's 3 canals, and they have fluid in them, and they're oriented in different planes. There's a vertical canal, a horizontal canal, and then one that's at a oblique angle. And if you can imagine like a hula hoop, I tell people, you got 3 different small hula hoops in your ear, and when you move from side to side, the horizontal hula hoop that's laying flat, it will the fluid will move in that canal, and you have little hair fibers that picks up the movement of that fluid, and those hair fibers send a signal through a nerve to your brain that, hey, you're leaning to the right, you need to put your left arm out and correct your balance. So these canals have fluid in them. Where they all connect, there's these little crystals, like salt crystals, called otoliths, which means ear stones. They're very tiny. They're like sand. And sometimes they get knocked out of where they're supposed to be, and they start floating around in one of these canals where they don't belong, like a winter snow globe when you shake it up.
Mm-hmm.
And when they start floating in the wrong canal, it'll tell you that you're moving in a direction when you're really not. So what we do to diagnose this is we'll have somebody lay flat on their back, and then we'll turn their head from side to side, and we'll say, does this make you dizzy? And they'll say, when I turn to the right, I'm really dizzy. Then we sit them up, and what you can do is you can watch their eyes just jiggle back and forth. We call that nystagmus, as you really literally have to hold on to them so they don't fall off the table until things quiet down. And that's really, it's called the Hall-Pike's maneuver, and that tells us that, yes, you've got these little crystals that are knocked out of place. So a good physical therapist or an ear, nose, and throat doctor can do this examination and know which canal that's where it shouldn't be, and then they know how to reposition the head to kind of allow those to drain back where they're supposed to sit and not float around. So usually 1 or 2 visits, 15 minutes of repositioning can take care of this problem. It's pretty amazing. It's pretty simple. But until then, I would tell people the simplest thing over the counter you can take is Benadryl. The best prescription that you can take is Andivert or Meclizine. But those just kind of control the symptoms until you can get the help you need, which is instantaneous in most cases, a correction of the problem.
But until it's corrected, it can be dangerous, not just like falling down, but especially, I would think, driving.
Yeah, you have to be really careful with those kind of things. And some people, they'll even get nauseous with them and they'll pull over. There's another condition very similar to that called labyrinthitis, which is a viral infection in those canals. So you just imagine a virus in that fluid that increases the pressure, and those people not only get dizzy and that spinning sensation, but they get really nauseous. And that one is just something that we treat with the anti dizzy medications like Meclizine until it gets better on its own. And sometimes it takes a couple weeks. But really, if you have these symptoms, what you need to do is see your primary care doctor. And if it comes on suddenly, and this just hits you out of the blue, you really should probably go to the emergency room to make sure it's not the stroke-like condition.
Mm-hmm.
That can be dangerous.
Because there's no way of preventing that, so to speak. I mean, other than heart health.
Right.
Is there any preventative measures with the inner ear?
Well,
I guess the wax, you can not push the wax in.
Yeah, it's hard to resist sticking a Q-tip in to clean that out when
they tell you to do that.
Yeah, when you bring wax out. But the ear canal, the body is amazing, and the ear canal is actually it actually is oriented so that when your body heats up just enough, that wax in your ear canal will melt and it will drain down to the part of your ear where you can reach with your finger and pull it out. And the reason the wax is in there is because it catches the dust and debris that comes in your ear, because we're around this all the time. But nature makes the wax and then melts it when your body temperature heats up and drains it down where you can pull it out with your finger. But sticking a Q-tip in can often push it back like a snowplow, and now you've got an obstruction or you're hearing impaired. And sometimes those are really difficult to clean out. It requires special suction devices and an ear, nose, and throat doctor to help you with that.
And y'all don't need your truck key either, because that can do damage.
Yeah, that's right. Well, we see a lot of times with men who have hairy ear canals, or they have a lot of hair clippings in there. That's part of the blocking issue. Some people, their skin will almost shed like a snake, and that will start to come off, but with the wax in it, it gets obstructed. Some people have very narrow ear canals, and they obstruct much easier than others. So just have them checked. It's pretty simple, but benign positional vertigo is really common, easy to treat, easy to diagnose. Don't if you're struggling with that, just see your primary care provider and let them help you with it.
There you are. And that is BPPV.
There you go. You got it.
Thank you, Dr. McKnight.